Rochelle, please state your where you're from and ask your question.
Hi, I'm Rochelle, and I'm from Long Beach, New York. This was a very comprehensive presentation, so I appreciate you for that. I think I have to watch it over a few times. There's so much information. My question is about dental implants. So a number of years ago, I had titanium dental implants that failed, and it caused neurological problems that kind of amazed me because I'm a healthy person. I a vegetarian or vegan, and no real health issues. So the implants, I got all kinds of neurological problems like brain fog, headaches. I had migraines. I was not pleasant to be around. I was like getting depressed, and the implants failed. They got infected. And as soon as they were taken out, all my issues went away, and it gave me a fear of implants. So my question is this: have you come across this? Why would this happen? And implants, I'm thinking of doing zirconian, but I'm kind of scared after my experience. So if you can address that, I really appreciate it.
Yep. I have seen this happen multiple times. Actually, we have people coming to us specifically to have their titanium implants removed for these reasons. So there's a couple of problems with titanium. The first is that conductivity. So like I talked about with the meridian systems, with the energy channels, when you put a metal dental implant in the middle of one of those energy channels, it's going to throw off the electrical conductivity of everything on that whole system, which is going to change your neurology. You're going to show up with symptoms across the board. And I didn't talk about this specifically, but that's why I pointed out right here, because this is a place that a lot of dental implants are placed. This is on the breast meridian, and I have yet to find someone who had breast cancer that didn't have either a root canal or a dental implant right here. So there is huge implication of those systems being affected by metal in the system. So that's just the first piece, is just simply it's a piece of metal. And so it changes conductivity. The other problem that we're having is that titanium is so overused in our world in general. So it's used in the hard candy coating on the outside of M&Ms and Skittles is actually titanium dioxide. Titanium dioxide is used in cosmetics. It's used in sunscreens. It's used in the bags that you get from Walmart. It's used in paint. It's used in so many things. And what we're finding is a titanium overload in our systems because we just aren't meant to have that much titanium in us. So you have all of that in the environment, and then you add titanium in the mouth. There's also a few people who have titanium sensitivity. Not typically an allergy doesn't happen, but it's a sensitivity. So I'm so glad you got them out, and I'm so glad your symptoms resolved. That's amazing. We do recommend zirconia to oppose all of the things I just explained. They are not conductive. You're not going to have an issue with it shorting those circuits, and it's not titanium, so we don't have to be concerned about this overload or sensitivity issue. Have I seen anyone with a zirconia sensitivity? I have not. However, zirconia implants are interesting. They are actually a little harder at the beginning to integrate. Integrate means bone growing to them. They're a little harder to get that to happen at the beginning. Once they've integrated, they're solid as a rock for forever and are better than titanium. But I wonder if they are not integrating at the beginning, it actually indicates some sort of a sensitivity, even to the zirconia a little bit. But I like what happens, because what happens is the body rejects them, and it's quick, and it's not painful, and it's not infected. It's really an interesting thing to see. Doesn't happen very often, but on a rare occasion it does. And I think the body's just telling us, nope, that one's not going to work for me either. In your situation, I think all of your symptoms sound metal-based, and I would suspect that you're going to be successful with the zirconia versions.
So, okay, question. So what are the dangers of having mercury fillings removed by a person who isn't SMART certified and doesn't do it in a very clean way? One, what do they use to replace that mercury filling, and how do you detox from that mercury overload?
So the dangers of removing mercury from someone who's not doing it with the correct protocol are exponential. Because what's going to happen is the mercury vapor, first of all, is going to get in your nose. It's going to get in your brain. You're going to swallow pieces of it. And mercury is one of those toxins that just goes and finds a neighborhood to live in, and it's going to hide. And it's really hard to get rid of it. So it's going to move into the brain. It's going to move into the gut. It's going to move into other places, and you're not going to get it out. So I would prefer that the mercury stay in your mouth in those fillings in a slow release system than for you to put a massive dose into your body, because you're going to have massive mercury symptoms like I had. So do not do that. You're going to find somebody that's smart certified on that IAOMT site that I talked about. That's actually the organization that does that certification. They're going to have a whole bunch of protocol for covering you, a big vacuum here at your chin. They're going to use a rubber dam so that none of the particles or pieces get into the mouth. All those kinds of things are going to be necessary when you get those removed. You are also, this is your third question, you're also going to want to do a metal detox along with that removal. So you're going to do two things prior to the appointment and during the appointment and after the appointment. You're going to make sure that all of your elimination systems are moving. That means your liver, your kidney, everything is working before you're going to do this procedure. So that's working with a naturopath or someone that can help you with those systems. Then once you get started with close to the mercury appointment and during, you're going to use binders. What those are is you're going to get some mercury no matter what during this removal appointment. Even if somebody's incredibly safe, you're going to get a little bit of an exposure. So we want a binder, which is basically a grabber. We want a grabber on board that's going to grab any mercury that gets released. And then we want another guy that goes, okay, now it's time to dump it. So both of those things are going to be they're going to be involved in this detox that you start before the appointment, during the appointment, and then after the appointment. You want this to continue for another few weeks after. So we have a metal detox that we use. Oftentimes you can get this through a dentist that does this protocol, or you can also get this through a naturopath. You want to make sure you're doing that so you're assisting your body in dumping anything that it does get exposed to, even during a safe removal process. So that detox is very important.
And well, given that you were exposed to mercury during, many, many years, and I'm assuming you hadn't done all these precautions, how did you actually clean it out, not knowing that, not being able to do so ahead of time?
Yeah, so I had to do a very slow chelation. So chelation is grabbing, basically. Or chelation is pulling. I had to pull it out from all of those different places. And so there's chelators that you can use. And a lot of these systems, there's some different chelators. You can use zeolite. You can use even chlorella is a real low dose kind of thing. Chlorella or even cilantro are some low dose things that you can use. EDTA is another that you can use. So there's different versions of things you can use to pull the mercury first and then to dump. So you need to have also some antioxidants, glutathione, things that can help you really counteract the effect of that mercury in the system also. It's interesting because when I first started to go through getting rid of the mercury, basically doctors said, this is going to take a long time. And it did. It was years before I really went, okay, my brain's back. I can tell it's back. So this is something that you really need to have someone helping you through, to making sure that you're getting it all pulled out and getting rid of it all. But here's another piece actually along with the mercury that I think is important. You can't just do a blood test to assess this, because the mercury hides. It hides in the tissues. You have to do what's called a provocation test, meaning you're going to take something that's going to pull the mercury out of those organs first, and then you do a urine test, because it's going to pull it out and then you're going to eliminate it. And the mercury that actually is in mercury fillings is going to eliminate through the kidneys. So the urine test is going to be the most accurate. There are multiple tests you can do. That you can test hair, you can test blood, you can test urine, but the most accurate is going to be a provocation test. You pull it out, then you urinate it out, and you test what comes in that urine. And you can get these mercury provocation tests. It's going to be much more accurate.
Great, thank you so much. You also made a comment on vegan and vitamin uptake. So Dr. Michael Greger, I don't know if you're familiar with his work.
Mm-hmm. Yep.
Dr. Michael Greger has a video and where he talks about a dietary intake study that showed that vegans were deficient in calcium, iodine, and B12, whereas omnivores were deficient in calcium, fiber, folate, iodine, magnesium, C, and E. So I'm just wondering where you're basing that vegans have a problem with uptaking vitamins. Is there research on that supports that?
There is research, and it starts with Dr. Weston Price. So it's the fat soluble vitamins that are the concern. And the problem with our food supply is that most of our food is deficient in everything that we need. So it's often not how you're eating anymore as much as what you're eating, the sourcing for your food. And most of the food, like you said, fiber deficient in omnivores. Well, meat doesn't have fiber. So that's a big piece where they're missing out on that as well. So it's a combination of all of those things put together that are necessary to be able to get these nutrients. I have a lot of health practitioners that I see as patients. So, I see the doctors, I see the health coaches, I see the chiropractors. They come to me as patients. And those that have a vegan diet have some of the worst teeth that I've seen. And they're frustrated with this. They're saying, why? Why do I keep getting cavities? And so we very closely look at what could you be missing? And it's usually the fat soluble vitamins. So those are the pieces that they supplement. Once they supplement, things are okay. Things are okay. But it's just hard to get them if you're not eating any sort of animal product whatsoever.
All right. Our next question is Leah. Leah, where are you from? And please ask your question.
Hi, my name is Leah. I'm from Davie, Florida, and I have a 5-year-old daughter, and I was curious, what's your take on fluoride for children and the toothpaste?
They don't need it. So it's the same talk that I talk about with adults and fluoride. Teeth don't need fluoride. Teeth are not deficient in fluoride. So the best way to care for a child's teeth is to use a hydroxyapatite containing toothpaste or tooth powder. The one concern with the paste is to make it a paste, you need to add a binder. And the binder that's often used is glycerin. It just holds things together to make it a paste. Well, glycerin, when used on a tooth, actually plugs up the tubes that we want the minerals to get into. So what I find is that there are more minerals that are being uptaken by the tooth through a powder than a paste because of that glycerin or binder component. So I recommend a tooth powder. I've got a kid's tooth powder that's citrus flavored, hydroxyapatite containing, and it helps a ton with keeping kids cavity free. So no, fluoride is dangerous in anybody, especially a child. There are options that are just as good, if not better, than fluoride now with hydroxyapatite.
Thank you. Our next question is coming from Bonnie. Bonnie, please state where you're from and ask your question.
Hi, my name's Bonnie, and I'm from Bowie, Maryland. I had a couple questions. The first one is I just had some deep cleaning done for some pocketing, and they recommended a full mouth series, not the typical panorama one that you get, but the full mouth series so they can see everything in there. Would that be similar to the CT scan you recommended? And my second question is, I also have sleep apnea. I've been through the CPAP, the mandibular device, the laser. They talked about my jaw maybe being a few millimeters short and surgery. I'm going to have a sleep endoscopy, but you mentioned a growth plate. What would you recommend that over surgery, or when would you do one over the other? Because I'd rather the less invasive if possible. Thanks.
For sure. For sure. Oh, remind me of your first question. I just forgot it now.
Bonnie, please restate your first question.
Yes, the full mouth series.
Yes.
Is that the same as the CT? Okay.
Yep. Okay. The answer is no. And the difference is a full mouth series means they're going to be taking x-rays, individual inside the mouth x-rays of every single tooth. They're using that for gum disease because it does show the bone level next to the root. So it is a good thing to look at if you're assessing gum disease. However, it is not the same. The cone beam CT scan is a 3-dimensional image. I can literally take your whole head and do this to it. I can do nothing like that with a 2-dimensional full mouth series. So full mouth series is just a traditional dental x-ray. They're just taking a whole bunch of them. So it is not the same thing, unfortunately. Second question about sleep apnea. Well, good question. I see a lot of patients post-jaw surgery. What you need to understand about jaw surgery is that they are going to section the bone, either upper or lower, either way. They're going to reposition it, and then that's going to be screwed in place and fixed in place with plates and screws. That's all metallic. I have so many people coming and saying, can you please get these plates and screws out? And I have to tell them I can't. It's too invasive and it's too dangerous. We cannot remove those. So 100,000%. It is so much better to do an expansion appliance. It's a removable appliance. You just wear it when you sleep. It takes about 18 to 24 months, but it's only nighttime wear. It's going to grow the jaw rather than cutting and screwing the jaw in a new position. So a bazillion times over, do the appliance over surgery.